Just hi everyone. Hello everyone, this is Dr. Khan again. This is like my fourth Facebook Live in the last, I would say 36 hours, but very much, I would say, needed. I was not going to do one, but when I resected the left one out, you'll understand why. So this is a nice lady, 70 years of age. She lives on an island, literally on the Pacific side. So she has had a complete end block, 41525, initials MF. And so on the right side, you will see, I removed what is this right chest mass. If you will see, this is very well circumscribed, and you will see that it is grossly consistent with a lipoma. I'm going to send this off, and this is, if I run into anything abnormal, I'm going to remove it because I don't want this mass to grow and eventually become a bigger mass. So take care of this as I find anything abnormal. Now, as you will see, I did the end block. I cut out the excess skin. That's the previous incisions she had. Done end blocked. She had 1989 silicone implants. And then in 2001, she ended up getting saline implants. And so, as you will see, this is complete total implant capsule, all inflamed tissue removal. This is consistent with this tissue as well, which was at the bottom part. And you can see, look at how round and nice this is. But if you come to the left side, look at this outpouching here. When I'm going to remove my top glove as I go in, you will see, look at this severe contracture. And so what I'm going to do now is I'm going to go ahead and get started here. And overall surgery went very well. Minimal blood loss. And as I go in, you will see, look how thin this tissue is. And so she has what are, just looking at this, micro textured implant, Saline, was below the muscle. So as I remove this, you will see the fluid that's around. You can see it's not enough to send to cytology. All of this is contained. So as I go in like this, you will see it's very slimy and sticky, and this is the leaching of that silicone. So you can see all of this tissue, and you can see, look at the consistency of this. Right here. So this is your, let me go ahead and, I'm actually going to get a sterile towel. Right here. This is your 325cc implant. Again, there's a tag on it, but no make model. This is your textured implant. And as I go in, you will see the capsular tissue that is certainly super, super thin here, and all removed, including what is that inflamed tissue behind, such that all of that capsular burden has been removed. Now I'm going to go ahead and remove my top sterile glove, and I have a sterile glove underneath, and you can focus on the left side, and as you will see clearly what is a lot of scar tissue right here, and this was severely inflamed, angry, and look at this outpouching right here. Remember, she had the 1989 silicone, so I'm being the thing that this was potentially a ruptured silicone implant. The patient doesn't know, neither do we have the record from 2001, and so this might be called silicone granuloma, among others. So if I go like this, all of this inflamed tissue around was removed. This mark you see is the bovi cautery as I dissected out. Look at this mass. It's like, if you look at it, looks like a small animal with the head over here. So if I go like this, all of the inflamed tissue has been removed. We'll see shortly what is on the inside. Is supposed to be another saline implant. And as I dissect, let's find out what's in it. I want to go ahead and cut this out. As you can see, this is part of the burden, if you will. Look at this tissue right here. You can see actually the fascia of the serratus anterior on the side as the implant was sitting. I incorporated that such that all of that inflamed tissue has been removed. And as I go in, it's going to be a little bit tricky because it's super tight. So as I go in, so look at this tissue. I don't want to hurt the implant. It has happened before as I dissect, and I'm going to go super slow such that I'm able to make a small nick in this. Very tight, as you can imagine. This is a nice 70-year-old lady. She did her homework. Very meticulous, thoughtful lady. So, all right, here we go. So look at, so there is some fluid. I do not know if you saw this come out. It's this brown fluid. What I'm going to do here is I'm going to, if you can give me like a basin. If you can get me any sterile basin. As you can see this fluid, I want to collect this. As you can see, it's brown in nature. I'm going to push it up and it's wanting to leak out. And again, you never know what's on the inside. Total news to me. Total surprise. I was not expecting it. I just thought it was going to be. So I'm just waiting for a basin so I can collect this. I don't want it to collect over here and we lose a cc or so. So I'm going to get a sterile container. So I have a sterile container. Because remember, I'm going to take cultures. I'm just going to put it in here. Let me throw this away. Remember, this is the gold standard. Do you have a syringe, please? I got it. Thank you. Look at this. All contained. It's like a reddish brown color. I was not going to do the Facebook Live, but I'm glad I did. So as I go in, so I'm going to take my time to dissect. Certainly there's more, more that is at the inferior aspect. None of this spilled into the chest. You can see the inside. As you can see, my scissor, it's a heavy scissor and it's not cutting. You can actually hear me cut it. All right, I'm going to actually now go in with the other syringe. The gravity dependent portion. So this is enough between the two. Certainly cytology. It has this rustic appearance. Again, you never know what you're going to find. Remember, look at this bulge right here. So I'm very careful. This was like the whole focus of the surgery, this bulge. So I'm actually going to go away from it, stay away from the unknown. Now I'm going to cut this way. And look how thin this is. My ruler is good. I didn't use it for the other side purposefully. So if I slide this in, you will see how thin this capsule is, as you can see. And look at the color of this. This lady is so well read, she could give a lecture on my practice. So I'm going to go ahead and now use my hands as I tease this out. I do not want to hurt my implant. And so you can see, look at this tissue right here, all contained. It's very similar to the one we did yesterday at the hospital. I'm going to just drop this. And look at the consistency of this color. It's like brown mud. I'm going to put all of this out. And look at this tissue right here. I'm going to cut this open. Just want to see what's on the inside. Again, this is going to go to pathology. All of this is going to go to pathology. And look at this. You're going to hear the snap. And if I get my... It's very hard. Calcified. Let's see what this is, this mass. I'm going to go ahead and cut this open. So this is like a special collection. Watch your eyes, Emily. What I want to do is I want to set this separately. I want to cut this open separately. It's a ball of tissues like a golf-sized mass. And if I press it, it's a little bit spongy. Because it's walled off. Again, you never know what you're going to find when you go inside. And remember, any fluid around the implant is a red flag for that rare BIALCL. It has to be sent, that fluid has to be sent. You can see how hard this mass is, that the scissor is bending on itself. So what I'm going to do is I'm going to put it right here. And Emily, you're good where you are. I want to change my top glove. I'm going to get another sterile glove. So what I'm going to do now is, you can see this is like a ball of tissue that was on its side. I want to just cut it open and see what's on the inside. Rodwell, do you have the other? Do you have the other syringe? I'm good, thank you. So what I want to do is, if I press on it, it's a little bit spongy. So I'm just going to go ahead and look at this. And I can tell It is even more viscous and thick. It's even more viscous and thick. I already have another one. So it's an independent, it's like another sponge. Just like a, if you ask me, it looks like an abscess, if you will. Yeah, this one looks good. I want to collect all of it, and we'll send. I'm good. So it's very viscous, as you can see. And now, let's put this down. If I'm going to invert this out, you will see it's like a small, very thin sac. And look, all of this. It's like very thick. It's like mud. So there's a lot to learn from this case. So you can go ahead and point both sides. So the implant, what is supposed to be the nicer, better Saline from 2001, 24-year-old set of Saline implants, her second set. As you can see, you never know what you're going to find. So the end block is the gold standard. Number two, you have to be prepared as a surgeon for any fluid. Because if you're not looking or thinking the worst, you're going to miss it. If this spilled into the chest, you can only imagine, if this is an abscess, you have to admit the patient because she might get sepsis. And this has happened before, that one of the fluid collections on another patient came back as high bacterial content. And if you go into my YouTube page, you will see I did a video on this alone. So the third thing here is anytime you have this fluid, and you can come over here, Emily. So this fluid is going to be sent separately. So this is intracapsular, and then I'm going to send that fluid separately to pathology, to cytology, excuse me. This fluid separately to cytology, and that fluid separately to cytology, so that we know what it is and what it is not. The implants will be returned to the patient. Capsules will be sent to pathology for the capsules will be sent to pathology, rule out that very rare BIALCL CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, rule out breast cancer. And then I'm going to send this right chest mass off to pathology as well to confirm that this is indeed what is a lipoma, grossly consistent with a lipoma, so that we have that pathologic evidence that this is what is a lipoma. So there you have it. End block, the gold standard. 20 years from now, I cannot imagine this patient would have her surgery done any differently. You never know what you're going to find. There was literally, I would say, 2 surprises, 2 fluid collections, and I'm very happy with how the whole surgery went. This is Dr. Khan, Executive Plastic Surgery.